The Institute for the Study of Peak States presents the first International Psychoimmunology and Psychobiology Research Symposium. Different Causes of Anxiety, presented by Nicolai Hassing.
So our next speaker is Nicolai Hassing. He's an educator and social worker by profession, specialising in psychiatric conditions and behavioural issues. He was trained by the Institute in 2015. His research focus is on mental disorders with special interest in schizophrenia. So over to you, Nicolai.
So thank you very much, Shane. And today I'm going to be talking a little bit about anxiety. And I have chosen to talk about this issue because it's pretty often, many times a big struggle for therapists to work with these kind of issues. And there are many reasons why it's a big struggle. And sometimes it's just straightforward. But I've always had this special interest in what's difficult to work with. So of course also anxiety disorders has been a keen interest of mine. And one of the biggest problems is actually that when you have clients with anxiety issues, usually they come undiagnosed. They don't have a clinical diagnosis. And not that a clinical diagnosis is a quality in itself, but then they have to use their own terminology and describe what they perceive as anxiety themselves. And also with the language, if you just take the common language, if you see in German, there's no distinguishing between anxiety and fear. They have the same word for these two expressions. So so in that matter, it can be pretty difficult to distinguish whether it's one of what is really going on. And also there are a variety of anxiety disorders. And just to go back a little bit, a colleague of mine had been working with a client for quite a long time, and they were working on anxiety issues. And it was not until very late in the whole work they did that she realized that this client was referring to anything as anxiety. She gave an example where she felt like she was not worth anything, and that was causing really big anxiety. That was so disturbing. And there was another issue where she was feeling very disappointed, and it was such an anxious feeling. So it's really, you have to be really sharp on what the client is explaining to you about the issues and how they perceive it. So this is one of the struggles that you see pretty often. And also there's a variety of different anxiety disorders. And I'm not going to name all of them, but just a few of them. The most common ones. So the most common ones is generalized anxiety, which sometimes have to do with some kind of worry. Then we have panic attacks, which seemingly come out of nowhere. We have social anxiety, which seems to be connected to some kind of fear of getting embarrassed in public or humiliated. Then we have specific phobias. And with these phobias, then it's quite obvious what the anxiety is about, because then it's usually have to do with heights, certain animals, or whatever is the direct cause of the attack. So another anxiety disorder is obviously OCD, which we had a presentation on this Monday morning for some. And some might suggest, so now that we have a process for OCD, maybe it would work for any anxiety disorders. And it's actually quite an interesting question, because the most common symptoms when you do have an anxiety attack, even though it's from generalized anxiety, specific phobias, OCD, whatever, there are some elements which usually are present. So usually the client feels some shortness of breath. They have heart palpitations. They feel dizziness. They very often feel nausea. And it's all wrapped up in some kind of fear, which is or uneasiness, which is either directly to the symptom, like in the specific phobias, or it can be kind of like unknown what's really going on. We have not really any idea. So these symptoms can also be present in people who get triggered into the anxiety with the OCD, because they have this compulsion, and if they try to deny the compulsion to get outlived, then it can cause big anxiety. But what we know so far is that it doesn't work for any anxiety, every anxiety disorder to the least. And again, we have to be a little bit careful to see when it works, who it works with or not, because it's all about the symptoms really. So I know from one case, long time with anxiety, tried the OCD process, but it had really no effect. But another very interesting thing to look at when you see it when you look at all the symptoms from a peak state point of view, it is when you look at the nausea. So when you do have the nausea, it's usually connected to one of the parasite classes, which is usually the fungal parasites. So that might suggest that all of these anxiety disorders is connected to different pathogens. But for so far, we really don't know. But now that there's also dizziness involved, it could also be another special case which could suggest that it would be connected to mitochondrial dysfunction, what we call autism. So I had big interest in this field for quite a long time. And actually, before I had my first client, I even I thought I had a pretty good strategy on how to work with these type of clients. Because in 2013 already, I joined a course which was called Behavioral Diagnostics. And the behavioral diagnostics, it was based on the finding of Dr. Hammer and the German New Medicine. And I know a few of the participants out there are familiar with his work. So my first encounter with him was the behavioral diagnostics and what he called the constellations. So the concept of the constellation is that certain behaviors are triggered by specific traumas. And I think he describes there are about 25 different constellations which all give different types of behavioral dysfunctioning. And the concept is also that it's two specific traumas, either triggering back and forth to manic depressive states, or colliding at the same time, creating a third reaction, which could be paranoia or panic. And for me, I was really thrilled with this, because for me, we had a model on how it was really specific. It was not something unknown. And I was really taken back 3 years before, when I had a friend who was really suffering from panic attacks and said, we have no idea why it's occurring and there's no cure for it. And I was like, the truth must be out there somehow, okay? And when I joined this course, I was really thinking, well, maybe I have found some kind of truth here. Because what happened was we came across all these constellations, and some of them I could recognize, some of them I couldn't. But then there was a constellation they called the frontal constellation. And the frontal constellation seems to resonate with all the symptoms which I knew from anxiety. And the theory was here that these two traumas was getting triggered at the same time and causing this third reaction, which they call frontal fear, and which seemingly should be applicable for anxiety attacks. And I'm not going to go into too much details around the whole behavioral diagnostics tools, but I'm just going to mention the main themes which are connected to this. And the main theme number one So trauma number 1 or number 2, you have to heal it in a certain order, but I'm not going to go into detail with this. So one of the themes is you have absolutely no control. You feel powerless, you're helpless in a certain situation, which is usually due to outer circumstances. So no control is keyword number 1. So if the other element is present as well and get triggered at the same time, then you'll have this anxiety attack, and this other trigger is walking into fear. And it could be some kind of fear that you are going towards. Now you know that you're entering some dangerous ground. But what I also learned from knowledge and sharing knowledge and experience is that this walking into fear is usually the fear of walking into the future. So now I have this really, really great model, but I didn't really have a modality to apply it on, to apply it with. So I joined a course to become a psychotherapist, and I learned EFT, and I learned some other modalities, and then I learned something about peak states. And I was like, what is this peak stage kind of thing? And then I actually learned there was something called the biology of trauma. And I didn't really knew that this existed even. So I just read the books, and I was so thrilled that I now have a model to analyze what kind of trauma is triggering certain behaviors, but now also get to learn the nature of trauma on the other hand. So for me, it was not just a really, really big present. So I did the training in 2015 and got certified a bit later, and started to apply these concepts on the clients. So usually when we have a client, we go for the certain symptoms, and then we diagnose from what people are feeling in the body, and then we do some trauma healing all according to the bodily reactions. But now that I had this brilliant tool to work with, I didn't really bother. So I was trying to separate the elements, this no control and this walking into fear things, and I was healing these 2 elements separately. And this was usually generational traumas. And from experience, you know, the anxiety in the clients just vanished. So I've been using this approach quite a long time, and quite many clients. And then there was one time last year, I met an old friend, and she was having anxiety. And I said, well, I might be able to help you. And I don't know why I did this in this session, but I didn't stick to the model. I didn't stick to the procedure, which I usually did. We went into a trigger moment just when it happened, just maybe a few days before. And she was triggered into all this nausea, dizziness, shortness of breath, heart palpitation, and everything. And I did everything I learned from the book, everything, and nothing changed at all. And back then, I've heard from some of my colleagues that they were really struggling with anxiety sometimes, and then I thought, well, this is maybe what they are struggling with. So I made this hypothesis. We had to stop the session, and I had to just help her to feel a little better in the present, and eventually she felt good, but we didn't heal anything. So I was making this hypothesis that, well, it seems like, and this is still unconfirmed totally, but this is from my own ideas, that this has to do with some kind of pathogen getting activated, because we have seen other times when we do everything we have learned and nothing works, it might be some unknown pathogen which we do not know how to deal with. But there could also be another issue going around here. And maybe Grant would say that I haven't just tried everything. So if I tried all of the techniques we learned, we will eventually succeed. maybe. So it could also be that in the trauma situation, there were just multiple trauma streams, let's say maybe 50, and then we just take such a long time to heal upon. But also, it could also be a result of dysfunctional homeostasis, which is when the body really, really wants to hold on to this problem. So no matter what you do, it will redo the thing you do and then make it come back. Or it could even be time loops. So whatever, this is just hypotheses. And like I mentioned in the beginning, people come to see you with so many different descriptions of anxiety. So it's a symptom that the client has described themselves, and like I said, it's usually not clinical. So there are a bunch of special symptoms which can be present when people come to you and present this as anxiety clients. And I'm going to go through, and unfortunately I don't have the list for you, but you can find it in the subcellular manual, but I'm going to go through the list and tell what kind of special symptoms which are also causing anxiety attacks perceived in some people. So we have a symptoms which we call holes. So when you do have a hole, when you regress to the moment, it feels like there's a hole in your body, and it's caused by a very, very early big physical damage to a biographical trauma. So this is perceived as a hole, and when you put your attention around the hole, you get this really, really horrible feeling, which can easily be perceived as some kind of anxious feeling or some anxiety. And of course, what is also very common is, in my experience, generational issues, something that your ancestors experienced. Normal biographical traumas, which are from very early developmental damages. And of course, body associations. So what can be going on with body association is that you have this anxious feeling, but it's connected to some kind of nice feeling, which is like, this means comfort, this is the same as survival, this means safety. And this can also be the reason why it sometimes might be difficult to get rid of because of these body associations. But what you also have to be aware of is that, and you have to be aware of always when you don't have progress, it is if you actually copied another person. And copies, that can be quite a pain to work with, because it can take a while until you realize that you work with a copy, and all the normal standard techniques doesn't work with copies, only a special techniques, which is described in one of the books, I think. Because usually when you have an anxious feeling, and let's say it's from a copy, it feels very real. It feels so real that you wouldn't first think that it's from someone else. But it's not until someone suggests to you, so is this feeling from someone else or is it yours? That they sometimes recognize, well, this is not for me. And another way to find out that it actually feels like it sits outside of your body. It's not inside, but it's like a big balloon attached to your body. So another cause of anxious feelings, which are not from the one I already mentioned, that is if people get aware of parasites. So in 2012, when Grant first discovered the whole parasite issue, he realized that this is not something you talk about to anybody, and not to clients at all, because that would just freak them out. So if you realize in a trauma session that something is going on inside of you, and you get aware that this is actually a parasite, that can trigger anxious feeling, paranoia, and the whole spectrum. So if we have clients and we do become aware of parasites in the session, we do everything we can not to mention the parasite, because that might just freak them out for no reason. So another known cause for anxious feelings, we have inside of ourselves, from kind of like the throat to the hips, we've got what we call the column of self. it's actually a fungal structure which is not supposed to be there, but it's actually there. And usually it's not like it's supposed to be, even though it's fungal. So usually, well, how it's supposed to be like is one clear big plexiglass, but usually it's broken into pieces and causes many kinds of different dysfunctions. And sometimes, if you're really unlucky, inside of this column, it's hollow inside, and it's called a void. And when you put your attention into the middle of this void, it triggers the most horrible feeling I have ever tried, because I have had this problem, and I really mostly remember one of my colleagues' reaction to seeing me getting into this void, because it was almost like a little shock, because this colleague had never seen anything so dreadful like this before in another person. I was really in suffering. But I got it healed thanks to some other colleagues, and yeah, it's gone. So another trigger for anxious feeling, has been found in the Institute, is when people have experienced a spiritual emergency. So the client or the person now is really fearful about some unknown factors about the experience, or if it might happen again, or whatever is going to happen. Or even what was it that I really experienced, and how I'm going to cope with this. So there's also, from talking to a colleague the other day, who had been working a lot with anxiety and sometimes had results, sometimes didn't. You have been told that there is a special fungus which is getting rid of when you do the silent mind process. And this fungus is causing so many problems. It's causing the voices, it's causing the chords, which you've learned today. It can cause some other things, and also it was spoken to as multicultural issues. But it usually has to do something with people within your tribe. It could be your political party, it could be your family members, but it has to do with someone you tribal associate with. And usually when you really want to make big changes in your life, you can be very excited, you can be very thrilled, but sometimes you lose this desire. And this is due to the tribal block mechanism, where you just feel like you get heavy and you just don't want to do anything of the desires you just passed had. So if you really have these desires and you just feel like, well, I cannot really do it, then at least from one experience, my colleague was doing the silent mind technique, the full SMT, and eliminated the fungus, and the anxiety disappeared in this person. So also the last one, which is actually pretty new. So new things are discovered all the time. So I remember I was asking Grant, a year and a half ago when we met in Poland, because I wanted to do some more study on anxiety, and he said, we already know quite a lot about anxiety, and what you should ask the client is like, who makes you anxious? I was like, who? And it didn't really resonate with me. But then I understood what he meant, because earlier today, the manipulation mechanism was mentioned. And you can have a manipulator who is acting out in real life, like your spouse, your boss, your daughter, your anything, or even the street seller. You don't have to know the person. And this is when these manipulation fungus are acted out in persons. But if it's not acted out in a person, it can just feel like a silent presence in your field around you, with a threatening, like a threatening presence, which will cause you to feel something. And this can really easily trigger some anxious feelings. And to combine some of the knowledge which I gained from the course, there was this walking into the future could be quite fearful. We have a suggestion that it might be some fungal, because an OCD is a fungal structure. Some of the symptoms mentioned in the DSM really could indicate that it might be a fungal problem. And right here we do have a fungal which seems to be interacting and causing fearful feelings. So what I experienced with 2 clients now, it was not my suggestion, but it was one of the client's suggestions actually, because this person was aware of the manipulation mechanism. And this person said, well, I'm aware that the future might be out here as a manipulator, and I really fear going in this direction. And we heal this just as a manipulator, like we do the techniques. And it seemed to have some kind of effect. And then I had a colleague of mine who was really scared of the coronavirus, and I was trying to make her feel the same thing. And without forcing it on her, she actually recognized that the future could be out here somewhere as a presence, which was scary. And we healed it with the manipulation techniques, and it seemed to have an effect. So with that said, I don't believe that it's totally nailed, that we have totally found out what every anxiety attack is about. But at least sometimes you can do some workarounds where you apply some of your knowledge that you have already and apply it to the stuff that we have learned here, and then get great results. And sometimes you just go through everything you learned, see what kind of special symptom could it be, treat it accordingly, and then you have the effect. But now that we sometimes have some issues where it doesn't go away, I would still suggest that there are some unknowns to this. So this is still to be getting explored. Yeah. So I think this is what I had to tell you tonight. So if there are any questions, you can leave them now, and then I'll see if I can answer.
Okay, yep. So we do have some questions for you. So Edward Sorodo has asked, what do you think about the connection of German New Medicine or meta-medicine or similar direction in the ISPS work? Especially, what do you think about his constellations theory in the light of ISPS knowledge?
Yeah, for me it seems like a really great tool to use sometimes, because you have the emotional trigger to work from. So combining the knowledge can sometimes be very, very, very effective if you work in the present. So I think it's a very, very good idea. But my experience is also sometimes what the research is finding, it doesn't really resonate with the German New Medicine, but because also you have to understand that the understanding of pathogens and disease is totally different from the German New Medicine protocol. It's a totally different understanding. So all the pathogens are not supposed to be there. It's not like logical programs. This is dysfunction. We have to understand this. This is out of dysfunction, and it's not supposed to be happening. So the whole philosophy about these 2 things are very different, but they are definitely applicable.
Okay, thank you. Then we've got from Sergio Lille, who's clearly read the Subcellular Psychobiology book, because he's asked, how does dysfunctional homeostasis differ from a time loop?
Well, it's 2 different mechanisms. It's a good question. Well, dysfunctional homeostasis is practically a body association, which is placed in the endoplasmic reticulum, and time loops is in the pine cone, and is covering some part of the pine cone, which is where it's also representing some trauma strings on another place in the cell, actually. So it's 2 different mechanisms, and I think you can distinguish. When you have dysfunctional homeostasis, sometimes the problem comes back with even worse, and with time loops, the problem comes back exactly like it was. I think that's the difference.
Okay, and probably got time for one last question. So Daniel Sabosky is asking, can you speak more to that walking into fear concept?
Yes, I can. Then I have to go a little bit back. because when you're walking into fear, and when you look at, you have generalized anxiety, also social anxiety, is all about how you perceive to walk into some kind of threat. So when people have social anxiety, this walking into fear, this is walking into a social environment where I have in the past been embarrassed or something like that. So there might also be body association connected to it. But it's some kind of threat that you are facing and you are forced to walk into it, or at least it's some kind of something you cannot escape, but you have to go into it. Yeah, there's more to it, but yeah, but I can't really get into it right now. I cannot.
Okay. That's fine. So I think you'll need to connect with Dr. Mary Pellissier, because she's got a number of questions here. I'll ask one of them, and you two can probably follow up on some of the others. So she was asking, do you have some good surveys to try and differentiate and diagnose the different types of anxiety?
Sorry, can you ask me again?
Do you have some good surveys or some ways to try and differentiate and diagnose the different types of anxiety?
Yeah, usually people, they come and tell you exactly what it is, because if they have social anxiety, that's what they usually come and tell you. And if they have panic attacks or anxiety attacks, then you have to ask them kind of like, is it like with this panic, or is it like just this excessive worry all the time? And then I usually go for the symptoms. If they have this shortness of breath, heart palpitations, dizziness, nausea, and wrapped up in some kind of fear, then it's like what I call one of the normal anxiety disorders. And if it's not with these symptoms, then it's some kind of one of the special symptoms that I mentioned in the last, like a hole or copy or whatever.
Yep. Okay. And there was one last comment from Julian Ruhl. He said he's also noticed in a client that ribosomal voice was also triggering anxiety in them as well. So you've given a great, as we find in our work, we're constantly identifying new root causes of anxiety. And in the next session, I'm going to talk about in depression. So thank you very much, Nicolai. Really appreciate that. There might be a few more questions here for you to respond to online as well.
Thank you for watching. For more information, please visit www.pigstates.com and subscribe to our YouTube channel.